Is your skin trying to tell you something? Whether it's a breakout, a mystery rash, or pigmentation that just won't fade, our skin is a reflection of what's happening inside our body. I'm Dr. Jay Rutland, and today on the Health Exchange, we're joined by board-certified dermatologist Dr. Helia Eragi to break down how dermatologists decode the clues, treat chronic skin conditions, and restore confidence. Whether you're 17 or 70, this episode is all about taking your skin seriously. Let's get into it. Dr. Eragi, can I call you Helia?
Yes.
Is that all right? Call me Jamie, please. What drew you to dermatology in the first place?
So the funny thing is, when I was in high school and we had our biology class, and that was the first time that I got introduced to skin, and I learned that skin is the biggest organ of your body and how you can tell what's going on the inside based on what shows up on your skin. And to me, that was fascinating. And I remember I was waiting for my mom to pick me up, and my friend's mom just rolled up and we're just talking. And she asked me, she's like, "So, what do you want to be when you grow up?" And I just said, "I want to become a dermatologist." But when I went to UCLA for undergrad, I was kind of interested. I knew I was going to become a doctor, but I was interested in becoming a neurosurgeon. So I majored in neuroscience. And then fast forward in medical school, we had the course for studying skin. And I remember the resident who was teaching, the dermatology at that point, he only had 4 or 5 days to cover the whole thing. So he said, this is a lot of information. Don't worry about reading the whole thing. The test is just going to be on the highlighted areas. So I was just very interested. So I read through everything. And we took the test, and next thing I know, I'm getting a phone call. So then I found out that 85% of the class failed. And it was because the guy who wrote the test, he decided not to do the questions based on the highlighted areas. He just did it on everything. I knew the answers just because I read through everything because I was just interested. But people who had just studied the highlighted areas obviously didn't know majority of the questions. So that was when I just knew. I was like, this is what I'm interested in. This is what I want to do.
Is there a patient story that stands out?
There's been multiple, and I feel like each patient just teaches you something about yourself and reminds you of why you do, what you do. So I did a lot of medical missions when I was in medical school and when I was a resident. I just remember going on those medical missions and just seeing how many patients you can help with your knowledge of skin, the different skin manifestations versus it was, tumor, skin cancer, people that were immunocompromised, they have HIV, AIDS, and the exaggerated, presentation of the simple common things that we see here and how much we could actually help patients. And here in my practice, again, diagnosing, melanomas. Like, for instance, like a patient came in and they were just, they were there for a skin tag that they want to be removed. And I saw a spot on her arm and I asked her about it. And she said, "Oh, I've had that for a long time." So I looked at it with my dermatoscope again and I was, I think we should biopsy this. And she's like, "Okay, if you think so." And it came back as melanoma.
Wow.
So ever since then, I mean, she's obviously been very grateful. And again, that kind of reminds me of what dermatologists do. And we don't just, treat acne. We don't do just cosmetics. We can actually save lives or even like simple patients like acne, the teenagers that come in. And the first day when I see them, they come into practice when they have all the acne all over their face. They're very shy. They won't even make eye contact with me. It's like the mom is doing most of the talking. They don't even want to respond. And then after a few months, after I've treated their acne, they come in. Sometimes they come in without their parents. Like they just want their parents to stay in the waiting room area. And they're happy. They're smiling. They're making conversation with me. They're telling me about, prom or the travel plans. And just that smile and that confidence that I see in that patient, that really warms my heart. And it just gives me that, satisfaction. I'm like, to me, maybe it's just simple acne, but to that patient, it's just now restored their confidence. They look good, they feel good. So majority of what I do is not just about looking good. I want to help my patients to feel good.
I mean, honestly, like hearing you talk about acne just brings me back to high school because I was like, listen, I'm not trying to be arrogant. I'm gonna be a little confident, but I was a good looking kid until I was like 14. And then like all this acne just showed up on my face. And my
Mhm,
mom is very particular.
mhm.
And she was like, Jamie, what is wrong with your face? Like your face is grotesque. It's disgusting. And so like seriously, she's like,
Yeah.
you're going to the esthetician. So I go to the esthetician. I would get facials every single week.
Mhm,
Like she'd
mhm,
make sure I got a facial every week. And then I saw the dermatologist.
mhm.
And then I ended up taking Accutane
Okay, yeah.
like my senior year of high school, first year of college. When I took Accutane and I was done, my skin was all dry, like it's
Mhm,
supposed to do,
mhm.
but all of the acne had like fallen off my face.
Yes.
And I remember like I'm moisturizing my face again. I look in the mirror and I was like, oh, I'm back. Right. It
Yes.
was like, it was like one of those, it's just that
Exactly.
confidence that you get
Exactly.
infused with. And it seems like
Exactly.
that kind of drives you a little bit, is that confidence that your patients receive from what
Exactly.
you're doing.
Exactly, yeah.
And the other thing that's cool is like, in medicine, everybody knows I'm a pulmonary critical care physician. When we see incidental findings, it's
Mhm.
because, a CAT scan was done or
Mhm,
an x-ray
mhm.
was done or something like that. But for you, an incidental finding is a skin exam because you
Exactly.
were looking at that skin tag and you're like, hey, wait, what's that?
Exactly.
And that's like
Yes.
special to be able to like do something like that and affect somebody's life like on the spot. Like I
Yes.
gotta wait for a scan to be done or something like that, right? And it's like it's like all you.
Yes.
How have you seen dermatology evolve over the course of your career?
Now we have a lot better medications that are targeted just for that disease, for those pathways. So not only that we're seeing better results, but these medications now have better safety profiles. Also, there's a lot of advancements in, the aesthetic part of dermatology. So there's more advancements in the topical skincare products, the introductions of exosomes, or, the other treatments that we can do for every skin type. Before, we were very limited as far as like laser treatments to lighter skin type, like skin type 1, 2, maybe 3. Now, there are way more advances in lasers where it's safe for majority of the skin types.
So I got a dermatology question for you. All
Mhm.
right. Did Michael Jackson really have vitiligo?
Yes, he
He
did.
did.
Yes.
And then, so what treatment do you think that he underwent for his vitiligo? Do you actually think he,
Well, I'm not quite sure. I cannot comment on it, but I
yeah.
think he took the pill that, well, so we use it in skincare products with topical form of it, but I think you can take the oral form of it and it can make your skin turn white all over. I do not prescribe that for my patients. I don't think it's safe. It does have side effects, but it is available.
Wow.
Mhm.
So when we're talking about the skin, you already said it's the biggest organ in the body.
Yes.
What does the skin consist of? How would you describe it?
Yeah, so your skin is pretty much a protective barrier and it prevents all the pathogens, allergens, the viruses, bacteria from getting inside your body. So it's very important to keep your skin barrier healthy. A lot of skin diseases actually comes from that skin barrier getting compromised, like conditions like eczema, and that's when you can get actually bacteria get into your skin. So now you go from just having that itchy red skin to having staph infection and having a lot more problems.
So yeah, so like your skin is constantly exposed to the outside environment.
Mhm.
It's constantly in contact with all kinds of antigen, as you just suggested. And it's very well organized in a way that all the cells are really like right next to each other.
Mhm.
And when that becomes compromised, either because somebody develops a atopic dermatitis
Mhm.
or a psoriatic lesion or whatever, that epithelium gets compromised and now it's kind of like open to the inside of your body. So the
Exactly.
bacteria that live on your skin can kind of infiltrate that area and then they
Mhm.
can overgrow and
Exactly.
lead to a lot of different issues, right? A
Yes.
lot of different
And
problems.
also skin microbiome is very important. I think that's one thing that we don't talk about it enough. I think we talk about, your GI microbiome and how it's important to have like a healthy microbiome, but we don't talk about skin microbiome as much. And when people say that they have sensitive skin,
Mm.
it's either, too dry, too oily, rosacea, or they just say, oh, my skin is so sensitive, I cannot tolerate, a lot of skincare products. It's just because the microbiome of their skin has been compromised. That can be either, from diet, what they're eating, from, drinking, smoking, or also doing too much to your skin, using skincare products that's not right for you. And that's when you mess up the microbiome of your skin, that's when you can have all issues with breakouts, sensitivity, redness, dryness, itching, all of that. So that's one area in dermatology that I feel like we don't talk about enough, but do need to put more emphasis on that and educating our patients.
And you can manipulate that microbiome and
Yes, we can. So part of it is diet, educating the patients, on diet and also being on the right and correct skincare products. I haven't seen that many skincare products that puts the focus on repairing the microbiome. There is one skincare product that I know that I personally use myself. I have rosacea, so I know I have that.
what's rosacea?
Rosacea is when you get that, red skin, you get the flushing. Sometimes you can get breakouts with it. And your skin is actually very sensitive. And sometimes it feels like it's burning, it's irritated. My main actually skincare product that I always use day and night is by company skincare product is a moisture and actually balances your skin biome.
Mm.
So then I can tolerate other skincare products that I use for different reasons and for anti-aging.
Oh, got it. So there's a lot of conditions, and again, my clinic is very autoimmune and allergic disease
Mhm.
focused, and there's a lot of individuals that have autoimmune disease,
Yes,
and you can see skin manifestations almost first, right? So I'm always asking my patients, do you have a
absolutely.
rash? Do you have any evidence of what you would consider a dermatitis anywhere on your body?
Yes.
For you, when you're in practice, when you
Mhm.
see something like that, if you
Yes.
see a psoriatic lesion, if you
Mhm.
see a dermatitis and somebody's coughing, do you think that way as well? You might have something else
Absolutely.
systemically going on.
Absolutely. So your skin is like a window to what's going on the inside of your body. So when a patient comes in and they're coming in for a rash, but I'm not just seeing the rash, I'm seeing beyond that. It's kind of giving me a clue of what's going on the inside that's presenting like that on the outside. So depending on the kind of rash that they have, the location, their symptoms, then that's when I have my, little differential diagnosis. Those are the things that I'm thinking about. Then I know what blood work I need to order, possibly do a biopsy. And then depending on what it shows, then I refer my patients to the specific, specialty
Yeah.
doctors that they need to see. So for like lupus, they present with that butterfly rash on their face. So they might think that, oh, it's just rosacea. But when I see that, then I ask them other questions about, if they have any other symptoms. I look at their nail changes. I look at the rest of the body. I look in their scalp. I ask about systemic symptoms. And then if I'm suspicious of lupus, then I order all the blood work. And if it comes back positive, then I refer to other specialists.
And so, see, that's the difference between, a medical dermatologist
Yes.
and individuals who are out there doing aesthetics.
Yes.
Is medical dermatologists are going to be able to catch these systemic illnesses and can have
Yes.
a positive impact on a patient's life, right? In
Absolutely.
general, where if you have individuals that are just doing aesthetics and they're not paying attention to that, that's kind of a missed opportunity. And I know we'll get into that later, but I know you see individuals with cosmetic issues as well as medical issues. When you're addressing them,
Mhm.
are you addressing the medical issue first and then going into here's cosmetically what we can do, or how do you manage those patients?
Absolutely. So when someone comes in and they're coming in for a medical reason, the most important thing is to listen to your patient, know what their concerns are and what's bothering them. So first, I have to figure out if there's something going on with their skin that's causing it, and we address those. But if part of that is cosmetic, then I discuss the options that they have to improve it beyond the medical part. I personally don't like to bring up the cosmetic aesthetic part of it unless my patients ask me to. So I never want to make someone not feel good about themselves or make them feel insecure. But if someone wants to know about cosmetic stuff, then we get into it. I always tell them about there are different options. And then I feel like it just becomes more of a collaboration of these are the options. Which one do you think you want to do? I always talk about, pros versus cons, what's good, what's not good, side effects, all of that. And then together we can come up with a plan.
Oh, wow. So you allow your patient to approach you with the question. You're not
Absolutely.
sort of selling cosmetic,
No.
right?
No, no, no. Because at the end of the day, I want them to feel good about themselves. So something that I may notice and may not be something that they're concerned about. And then something that bothers them may not be a big issue to me. But if it bothers them, then it's my job to address that. and help them with that. And again, later on, if they want to know about other, cosmetic aesthetic treatments, then we discuss that. But I never force my patients to do aesthetic treatments. I know some doctors, when they see a patient, the doctor would comment on their skin and would ask about, oh, what skincare products are you using? Oh, you have wrinkles. Have you thought about Botox? I don't do that. I'm there to address my patients' concerns. If they want to learn about the cosmetics, then we'll take care of that after.
What are the top 3 things that people should eat for healthy skin? If you had to pick 3 things, you need to eat these things?
So, water hydration obviously is number one. And then number two, food that's rich in antioxidants. So, your fruit, berries are very important. Food that's rich in omega-3 acids, your chia seeds, walnuts, pecans, your leafy greens. Again, those are overall very good for your skin. And then there are supplements that you can take. Helia is one that you can take as far as, for sun protection. Again, when I'm discussing diet, I talk about food. And then if other people are more interested in, the oral supplements, then I get into that part.
Yeah. I like your approach there. When you're thinking about acne,
Hmm.
right? And I'm sure you see teenagers with acne, right? Because
Hmm.
we all go through it when our hormones are going crazy. How do you approach, say, a 14 or 15-year-old that's
Hmm.
coming in with acne?
So we have the pilosebaceous unit in our skin, which is that oil gland with a hair follicle. So during puberty, when the hormones start, the oil gland starts to produce more sebum. So that ends up clogging the pore. And then there is like a little problem with the keratinization, the top layer of your skin. There's a lot of dead skins because there's not enough cell turnover. That ends up clogging the pore even more. And that's where acne starts. So those are your regular whitehead, blackhead, mild acne. After that, we have a bacteria, which is called C. acne, on our skin, which normally lives on our skin. But again, when there's too much oil and sebum production, the C. acne kind of starts proliferating and that causes inflammation. And that's when you end up getting those inflammatory papules, the pustules. I call them the juicy breakouts. And then the severe form of acne is when you start getting those cystic, painful breakouts underneath the skin. So depending on what kind of breakouts that you have, that's how I approach, my treatments. If
So
you
blackhead, whitehead, juicy breakout,
and then the
painful
cystic.
breakout.
Exactly.
Okay.
Exactly. So there are different treatments for the different types of acne that you have. So depending on your age, the type of breakouts, is it just a regular acne? Is it hormonal acne?
Mhm.
Is it because of stress? Is it, diet? So we have to take all of that into consideration when it comes to treatment. So it can be as simple as doing the topical treatments, doing a little, tretinoin cream for nighttime, maybe doing the topical antibiotics to prescribing oral antibiotics if needed. And if that didn't work for the severe cases, we do Accutane.
Ooh, yeah.
Mm-hmm.
One of the things that I always get concerned about with teenagers, and again, I got 2 little girls. I
Mm-hmm.
got a 12-year-old who's got a ridiculous skin routine. I don't know
Yes.
where she learned it.
Yes.
I don't know how she learned it.
Social
But
media.
yeah,
Yes.
exactly.
Yes.
Right? She's got 15,000 products
Yes.
that she puts on her face. And I'm like,
Mm-hmm.
dude, I don't think it's healthy to put
Yes.
15,000 things on your face.
Exactly.
But she does
Exactly.
this every day. And
Yeah.
again, yeah, she's my kid, but she's a beautiful little girl.
Mm-hmm.
And I don't know how to approach that with her.
Mm-hmm.
But I also worry about if she does, and she's going to have some acne, right? They
Mm-hmm.
all are going to get some. Like, what about scars and pigmentation? Like, how do you manage that? Right.
Yes.
With little girls who
Mhm.
get their confidence from what they look like. Right.
Yeah.
Most little girls, they just do. So how do you address the scarring or the pigmentation that can
Mm-hmm.
happen? When should somebody see you
Yes.
and say, you know what, we need to do XYZ to prevent this or to treat this?
I think social media is a huge problem. I feel like there's a lot of younger kids, preteens, that they don't need to be doing the 15,000, skincare products that you're talking about. Majority of those influencers do not even use the products that they are exactly that they're promoting. I mean, that's their job. They're getting paid. Nothing against
No
influencers.
worries. Nah.
But the problem is these preteens, they want to look like that. So then we have this problem, and it's a big problem. So for the younger kids that really don't have any skin issues, honestly, majority of these skincare products that these influencers are promoting, it can end up hurting their skin. So I think it's very important to have that talk. And if they're not going to listen to you, I think it's very important to take them to see a dermatologist and we can talk to them about it. We can educate them on their skin, what they need, and what can actually potentially hurt their skin, make their skin more sensitive, which can cause more problems for them down the road. It can cause more of the acne breakouts. Now they have that dry, irritated skin. So I think it's always a good idea to just take them to see a dermatologist. And if they're having any skin issues, then we can address that.
Is there a product out there that's being used and you're like, oh, absolutely not, never use this?
Any of those, I think the vitamin C serums are way too strong. A lot of those anti-aging that has like retinol in it, or some of them have higher percentage glycolic acid, salicylic acid. I'm like, you don't need that. Later in life, you do,
Yeah.
but now you don't. I would just stay away because I get phone calls not just from friends, but moms that bring their kids in, and now their skin again, they're having the redness, the rashes, the irritation, more of their breakouts because of the wrong products they're using.
Atopic dermatitis, eczema.
Hmm.
The reason I always talk about it is just because it has a heavy association with asthma, right? A
Yes.
lot of the kids that I see
Mhm.
and adults that I see. What is atopic dermatitis for eczema?
Yeah. So atopic dermatitis or eczema pretty much is that red, dry, itchy rash. You can get it in childhood, and unfortunately, it can progress into adulthood, or it can go away and then it will come back as an adult as well. It's pretty much a problem with the skin barrier. So it's actually like a genetic mutation. So people that have eczema, their skin is not holding onto the water like our skin does. So ends up getting very dry. It gets itchy. They scratch it. It hurts that skin barrier even more. Then it gets more dry. It gets more itchy. It just becomes a very bad cycle. And then, as we talked about it, once the skin barrier is compromised, then all the pathogens, the allergens can get in. Then it can cause more of, the inflammatory rash, and these patients can have, sensitivities to certain food, to certain, topical products, environmental allergies that they can have. They need to be, treated, because if you don't treat eczema, unfortunately, it can get a lot worse. And there's correlation exactly with asthma and other allergies as well.
So when you're treating eczema, I
Hmm.
mean, again, always investigate, make sure they don't have allergic asthma, make sure they don't have chronic rhinosinusitis,
Hmm.
nasal polyp, all that kind of stuff. When you're initially treating eczema, are you using topical steroids? Is that what you're doing most of the time? Or what's your
Yes.
range here?
So again, depends on their age,
Mhm.
the type of eczema they're having, and the severity. So if they're young and it's just like a regular mild eczema, yes, we do a little topical steroid, low potency, just to bring down the inflammation. But the key is skincare, how they take care of their skin. So then we discuss, how to moisturize, what moisturizers to use. When they shower, don't do hot shower, do kind of like lukewarm to warm. Don't stand under the water for like extended period of time. When you come out of the shower, within the first 2 to 3 minutes, when your skin is still wet, that's when you want to put the moisturizer on to lock in that moisture. As far as, the detergents, you want to go in with hypoallergenic, things that are for people with sensitive skin. What they wear, certain textures can irritate their skin. So usually like cotton is better. Wool can really, irritate people that have eczema. And then we talk about obviously diet. We talk about, skincare products that they're going to use, perfumes, even shampoo, like lotions, everything that's going to come in contact, with their skin. But if their eczema is beyond just a mild, if it's all over, if we've done topical steroids, it's not helping, we can do like a short course of oral prednisone, again, just to knock it down. But if it's something that's for them, it becomes chronic, then we do discuss, other medications. There are a lot newer medications that's out there available for eczema now.
Yeah, when we see severe eczema on
Mhm.
people, we are going to see people that are also going to have asthma. And if you think about it like this, your cells that are constantly exposed to the environment, your skin cells, your upper airway cells, your lower airway cells, and your GI tract cells, they're all epithelial cells. They're all
Mhm.
cousins, so to speak. And so when they become inflamed as a result of an antigen that they're presented with, they're all going to lead to the production of the same type of cytokines that leads to worsening of that inflammation, right? And specifically in skin or in eczema, what we talk about is this type 2 inflammation. And so
Mhm.
yeah, we're going to use the topical therapies first, right? We do the same thing with asthma. We do the same thing with chronic rhinosinusitis. We do the Flonase. We do the Symbicort, which is inhaled corticosteroids or whatever to calm down the inflammation here. They do a little bit of topical steroids here. But when you need systemic therapy,
Mhm.
here, say oral prednisone, that's when we got to start thinking about calming down specific cytokines. And there's a
Exactly.
molecule that we share that we use probably every day, Dupixent,
Mhm.
that we use to calm down
Exactly.
atopic dermatitis, which also treats asthma. It also treats prurigo nodularis,
Absolutely.
urticaria. It also can treat eosinophilic esophagitis. And all of these inflammatory conditions are related, right? They're all related to one another because of that type 2 inflammation.
Exactly. Dupixent has just been a game changer. I love Dupixent, especially for those patients that their eczema is just beyond like a little itchy, scaly rash. So it's a great medication to be on just to control it and other, symptoms and everything that you mentioned.
Yeah. When we think about other skin conditions, right?
Mhm.
Some of the common ones that you see besides atopic dermatitis, besides acne, what else do you see commonly?
Seborrheic dermatitis, that red, itchy, flaky scalp is very, very common. And sometimes patients think that they just have dry scalp. So they come in, they're like, oh, yeah, I have very dry scalp. And it's not. Seborrheic dermatitis is caused by this yeast that, again, we all have on our skin. And sometimes it can flare up and it produces that flake. And sometimes it can cause more of an irritation. If it's just very mild, I do discuss over the counter, shampoos that they can use. Anything with salicylic acid, selenium sulfide, tar, zinc can help with that. But if they've tried it for 4 to 6 weeks, it's not helping, then we'll go to prescription strength, ketoconazole 2% shampoo. But again, if their scalp is really inflamed, sometimes I do have to prescribe topical corticosteroid ointments that they need to use for a short period of time just to knock down that inflammation and then maintain it with the shampoos.
Oh, wow. When you look at all the skin conditions that
Mhm.
you have seen, what's the
Mhm.
gnarliest one you've ever seen?
Well, to be honest with you, sometimes even simple things like acne. I've seen some really bad acnes where, again, when the patient comes in, and usually it's like a teenager, more common in male, it can be very severe. And that's when, I know that I need to help that patient. It's just beyond just the aesthetic. It's like, it's just hurting their self confidence. Like they're depressed. They don't want to go out. They don't want to socialize. So that's for me, it's not just acne. It's like, I need to give this kid his life back. Or sometimes even with psoriasis, we can see very severe forms of psoriasis where there's just so much flaking that these people they don't even want to go out because wherever they go, they just feel like, they're constantly shedding skin. People think that they have an infection. That's when you feel like a real dermatologist and you're like, I need to help these people. I can help these people. And I tell them, I'm like, I can get you clear.
And when you help these patients, how
Mhm.
does that make you feel?
Oh, it's the best feeling ever.
Yeah.
The gratification that you get from truly helping people, nothing compares.
I know we're just throwing terms at you. We're throwing terms like urticaria, psoriasis. So psoriasis is an autoimmune condition. It's usually seen on the skin and extensor surfaces,
Mhm.
like your elbow, your knees, can be seen in the scalp. And then I'll also see a lot of them in the abdominal area, kind of on
Mhm.
the lateral side here. I'll
Mhm.
see that. Urticaria is just like raised red skin, right?
Mhm.
It's associated with a immune cell called the mast cell. The mast cell is kind of like a cousin of an eosinophil and a basophil. It has these little granules on the inside and releases a lot of different inflammatory mediators like leukotrienes, histamines, and then these molecules just increase the amount of inflammation surrounding their area. And again, as we've learned more and more about the immunology of these cells and immunology of these conditions, we're able to apply these newer therapies, which I'm
Yes.
sure you're using all the time in
Yeah.
these patients who are
Yeah.
severe.
Biologics and then, JAK inhibitors, they've been game changers.
Yeah.
Absolutely.
So when you understand that, inflammation is essentially cells talking too much. So it's
Hmm.
kind of like kids in the back of the classroom that are talking too much, right? It gets really, really loud in the classroom.
Hmm.
Same thing happens on your skin. When it gets really, really loud, your skin gets really, really red. And what these molecules are, the JAK inhibitors, the biologics that inhibit specific cytokines, is they're just telling these kids to like STFU, right? The
Hmm.
way that they
Hmm.
do that
Yeah.
is they're putting tape over their mouth or they're kicking them out of class and send them to the
Mhm.
principal's office, right? That's how these JAK inhibitors and these other biologics work
Mhm.
essentially. Like we
Exactly.
can get into the science of it and I could tell you exactly the molecules that they inhibit, but for lack of a better way or lack of a scientific understanding, just know that we're just telling the inflammatory cells of the skin to just be quiet.
Exactly.
Now it's time for What's the Buzz, presented by BuzzRx. Every week I answer a health-related question from one of our viewers. This week's question: my dermatologist prescribed me tetracycline. Why can't I go in the sun while taking it? Is it really that dangerous? This is a great question, and I'm going to tell you why it is actually that dangerous. You see, when you take tetracyclines, they actually get into your skin and they are going to absorb that ultraviolet A light from the sun. When they do that, this can lead to the generation of what we call reactive oxygen species. These reactive oxygen species can actually activate an inflammatory response that damages skin cells, and it creates this sunburn-like reaction on your skin. And so when you are actually taking those tetracyclines, that's why we want you out of the sun. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. We're going to call this section More Than Skin Deep, okay?
Okay.
I'm going to ask you questions, and I want you to give me like the first thing that comes to your mind really quick.
Okay.
All right? First question. One thing you wish every patient knew before their first dermatology visit.
We look everywhere. So please come prepared. I'm going to have you take your clothes off, but please have underwear and a bra on. There's been incidents where I'm like, okay,
Oh.
please, yes, put underwear on and bring your medications.
I always tell my patients to just take a picture of what you're taking.
Yes, or take
Right?
a
So I
picture.
can see
Yeah,
the ingredients and put it on your
exactly.
phone and your favorites and say meds. Again, this goes along with my daughter. What's the most overhyped skincare ingredient right now?
Exosomes. So exosomes are great, but if you're just topically putting it on your skin, they're not going to do anything. It needs to get underneath your skin. So here in United States, actually, you cannot inject it. I know in other countries you can.
What are
So
exosomes?
so exosomes are like little carriers, okay? So they carry protein, growth factors, DNA, all the good stuff with them. So potentially can help with cell regeneration, healing, collagen production, all of the good stuff. But it needs to get underneath the skin. So you get all those, topical skincare with exosomes in it. You can rub it on all you want, but
And
it's
when
not
you
going to
say
do anything.
underneath the skin, you're talking what? There's the dermis, the epidermis,
It
and
needs to
then
get into the dermal
it
layer.
needs to get into the dermal
Exactly.
layer of the skin.
Exactly.
Okay. Most underrated skincare habit no one talks about. I think I know what you're going to say.
Sleep. The whole cell regeneration healing, it happens at nighttime. I tell my kids, I'm like the human growth hormone, it gets released at nighttime. You want to grow, you want to get stronger, you got to sleep. Also, people that don't get enough sleep, their cortisol levels tend to be higher, and cortisol is what breaks down collagen and elastin, so it leads to premature aging. So 7 to 9 hours of sleep. I prefer 9. I don't get to sleep 9 hours
I was going to
every
say
night.
7 to 9 hours of sleep. I don't think I've slept 7 hours in
I know,
years.
you need to.
Oh, I know.
Just make up for it on the weekends. During the week is hard. I make up for it on the weekends.
What's the one skincare mistake that drives you up a wall?
People that don't wear sunscreen
Oh.
because they think that somehow sunscreen damages their skin more or causes skin cancer. I think there's a lot to say about sunscreen and the different types and what you should be using. But I just want to make this statement: sunscreen does not cause melanoma. Sun exposure does.
Exactly. You guys, sunscreen has products in it that reflect the light away
Mhm.
because the ultraviolet light can be damaging to your skin, right? It's got
Yes.
some ozone even in some of the sunscreens. It just reflects the light away. So sunscreen does not cause cancer.
No. So we have two types of sunscreen. One is mineral or physical. As you said, it reflects the UV and UVB, and those are your zinc and titanium oxide. And then you have the chemical sunscreens, and those are the ones with avobenzone, oxybenzone, that they're getting a bad rap because those chemical sunscreens, they absorb the UV and UVB and they release it in the form of heat. So some of it can get absorbed, and there's a lot of drama around chemical sunscreen. If you get a lot of exposure to chemical sunscreen and that gets absorbed into your system, it can potentially, be like a little hormone disruptor, disrupt some hormones, and it can affect marine life, like coral reefs. So that's why Hawaii and like Key West ban chemical sunscreen. So for people that are very, aware of chemicals and they're very conscious and they don't want anything like that on their skin, then it's like go with mineral sunscreen, go with zinc and titanium oxide and just reapply every 2 to 3 hours. I'll be honest with you, for my kids, I use mineral sunscreen. Okay. So I don't want chemical in their skin. So I use that. For myself growing up, I've used chemical sunscreen myself. I used to be a swimmer. I used to double sunscreen. I would put the chemical sunscreen on first. It lasts longer. And then I would put the zinc or mineral sunscreen on top of it.
If you could only use 3 skincare products,
Hmm.
what would they be?
That's hard. I would say definitely sunscreen.
Okay.
Moisturizer at nighttime. I'm more on the dry side. And if I were to pick the third one, I would go with antioxidants.
Antioxidants.
Hmm.
Like topical
Topical
antioxidants?
antioxidant serum. Yes, something with vitamin C, vitamin E, and other good antioxidants in it.
What's the most unusual thing someone's asked you to just take a look at?
Things in the private area. Oh, I think I have a little skin tag down there, which was not a skin tag.
What was it? You know I'm gonna ask.
It was a form of condyloma, which
Oh,
is, yeah, herpes
yes.
virus.
Got it. Okay.
Yes.
If you could invent one magical skincare product, what would it do?
Oof. like a topical cream that would just instantly just lift and tighten the skin, just lift it up instantly.
What is your favorite way to relax after a long day?
Ideally, in ideal world, get home, have the kids be quiet and not ask a million questions so I can just sit on the couch and watch some mindless TV. There's always something going on, activities, sports.
And if they are quiet, they're mad and they want to let you know that they're mad.
Oh,
So they're breathing all hard and
yes,
they're slamming things
of
down. And they'll be
course.
like, what's wrong? I'm like, nothing.
No.
What's the skin condition you see most often but wish people took more seriously?
I would say eczema
Mhm.
because people just assume it's just dry skin and they don't do anything about it. And I'm like, it's not. And there are things that you can do. You don't have to suffer from eczema. There's simple things that you can do, your skincare routine.
I always want people to look as good as they possibly can. I want
Mhm.
people to be symmetrical. I want
Yes.
people to have the skin that they want to have. I understand all that. So for you, who's a good candidate
Mhm.
for aesthetic dermatology? Because it sounds like in your practice, you're not selling aesthetic dermatology.
Mhm.
You're waiting for the patient to ask for it.
Yes. For those patients that come in for, general medical, I don't talk about aesthetic till they bring it up. And then I have those patients that come in strictly for aesthetic
Oh, so you have two sides
reasons.
to your
Yes,
practice.
yes,
We got
yes,
two
yes.
doors.
We
Okay,
have to
I
do
got it.
that. Absolutely. So then for those patients, we discuss the different options. I listen to them. I listen to the concerns that they have. I want to know what it is that bothers them. So I know how to address it. And then we talk about the different options. We talk about as far as skincare products, injectables, Botox, laser treatments, facials, all of that. So depends on their age. So I think for people that are on younger side, Botox is a preventative treatment. If you are in your 50s and 60s, you've never been on a good skincare regimen, you've never worn sunscreen, you have deep wrinkles, you have a lot of skin laxity, Botox can soften those, muscles. It's not going to get rid of those deep wrinkles. So Botox is good for people that have just started to notice, those fine lines. And that's when you want to get the Botox on so those fine lines don't turn into deeper lines. So someone in their late 20s, early 30s, that's when you want to get started with Botox.
How often?
So it lasts 4 to 6 months. When you're on the younger side, you can wait a good 6 to 9 months. But usually, yes, 4 to 6 months, you want to do it. And for other treatments, microneedling laser is a great one to do for people that have mild to moderate skin laxity. I'm always, very honest with my patients. If I can grab your skin and there's just extra skin there and there's a lot of laxity, microneedling laser is not going to do anything for them.
So he like grabbed their cheek, like, bro, I
I
can't do anything about this.
I do because, they say, "Oh, can you do fillers here, here?" And I tell them, I'm like, "Your problem is skin laxity. Like you have so much, skin laxity that you need this. You need this. You need the skin. You need the muscle underneath it to be lifted."
So you send them to your husband.
I send them to my husband. I say, "Go in for a consult." I'm like, "I'm not gonna take your money. I'm not gonna do fillers on you. I'm not gonna do, microneedling laser on you because you're not gonna get the results that you want." I can pretty much help people between, I want to say, age of 26, 27, up till 60, maybe 65 if they've been good about skincare products and taking care of themselves. After that, if it's just, too much skin laxity, I'm like, it's beyond my specialty. You need surgical intervention at that point.
So one of the things I noticed about your practice is you
Mhm.
work with your husband,
I do
who's
work
a
with my
plastic
husband.
surgeon.
He is.
I'm
Yes.
sure he does
He
faces.
does faces.
Like, listen, I love my wife,
Yes.
but like, very much. Like, I love you very much, but like, all day, like,
Yes.
how is that dynamic? Is it fun? Is
So the key is balance. I don't work with my husband every day.
oh,
I work with him 1 or 2 days a week, and I'm actually in another location. We have 2 offices, and
okay.
so I am in Huntington Beach,
Yeah.
2.5 days. So I'm with my husband 1 or 2 days a week. So we're not together all the time, but we're also very good about not getting in each other's business. So when I'm there to see my patients, I'm there to see my patients. If he has a patient that they need some sort of, skin consultation, I go in there, I do my consultation, I give him, what I recommend, and I leave. If he ever needs my help, I will help him, but I don't get in his business. He doesn't get in my business. If I have, again, a patient that I feel like I cannot help them, they need surgery, he comes in, he does his consultation, and he leaves. So yes, we don't practice beyond our specialty. We're
Yeah.
very good about sticking to what we're, experts in. And then we pretty much, if the patients need anything else, we refer them to, yeah.
So what is like I keep hearing the word like laser thrown around a lot. Like everybody always like, oh, you need to go get lasered.
Laser.
Like, can
Yes.
you please explain like what you dermatologists mean by get this laser
Mhm.
treatment? Like, what are we
Yes,
talking
you
about?
are so funny. Alright, so there are different lasers out there, okay, for different skin issues. So there are lasers that will remove, hair.
Okay.
So hair removal. There are lasers that address skin discoloration. Okay. So if you have just pigmentary problems, you want to do laser like IPL, some Nd:YAG lasers, it will address, pigmentary problems. And there are lasers that help with skin laxity. They from your skin. They tighten your skin. So those are more of your CO2, ablative, non-ablative, which is like Fraxel, Halo, Moxie, all of that.
I don't know what the hell you're talking about,
I
lady.
know
Like,
there's so many lasers out. And I agree with you. Some
right, yeah.
patients here, oh, I gotta get laser done, but they have no idea what kind of laser. So that's when again you should see your dermatologist. You should discuss your skin concern. So then I would tell them you need this laser. Like I tell them specifically, this is a laser treatment you need to get because it's so easy to get sold on so many different laser treatments that you don't need or laser treatments that's not even the good option for you. That's not even going to treat what you want it to treat. Or like IPL treats like, brown and red,
What's IPL stand for?
Intense pulse laser. So
Okay,
technically it's not a laser, it's a light therapy, but it treats people with rosacea, people with pigmentation. It's great for that.
got it.
Again, CO2 ablative, that's when, it gets rid of the top layer of the skin.
You remove the dermis
So CO2
or epidermis.
ablative laser removes the epidermis, which is the top layer of your skin, and it
Why the hell
heats
would you
up.
want to do that?
So when you do the ablative laser, that's for people that do have a lot of more of the deeper wrinkles, a lot of the pigmentation. It's like they're usually older or not necessarily older, but they have more sun damage. So it goes deeper, it's more invasive, it gives you greater results. That's the one that will actually give you more of the skin tightening and helps to treat the discoloration, but there is downtime associated with it. And that's the one that you cannot do for just any skin type. Usually it's skin type 1, 2, and 3, the lighter skin type,
Yeah.
you can do it. Darker skin types, you're at higher risk for hyperpigmentation,
Yeah.
scarring. So you never want to do ablative laser on somebody with darker skin type.
And so these are all anti-aging
This
and
is
aging
anti-aging
prevention
for
type of things.
exactly for treating discoloration, for promoting collagen production, elastin production to firm the skin, tighten the skin, give you that nice, radiant, healthy looking
And
skin.
you do like the whole face.
You do the whole face.
How long is
Yes.
it like a session for like the whole face?
How long it takes? About depending on what laser you're doing, about 30 minutes.
Are you
Yeah.
are you there watching it or are you just like
I
putting on
do it
autopilot? You
myself.
do it yourself.
I love doing lasers. That was one thing that I was very passionate about when I was doing my
Yeah.
residency. So I did a lot of laser treatments and I still love it and I still do it
Have
myself.
you ever lasered yourself?
I have.
So
I have. I you
you
stand
just
in front
grab
of the mirror and
you just
yes.
laser it yourself. It's
And
like
my
a handheld device?
yes. And my husband's like, "What are you doing?" I'm like, "Well, somebody's got to do this." I know. And-
You've got medical dermatology, and
Mhm.
I'm guessing you take insurance for medical dermatology.
Yes.
And
Yes, I
then
do.
for your cosmetic dermatology, you're probably all cash.
It doesn't yeah,
Depends.
insurance won't pay for it
Insurance doesn't pay for any
anyways.
of that stuff.
Exactly, yeah.
So they're not paying for the laser treatments.
No, they don't.
How do you manage that? Have you ever seen somebody cosmetically and been like, hey, listen, we got to go take care of this on the other side of the building first, and then we'll come back over here?
Yes. For patients that have acne and they're come in for acne scars, acne pigmentation, but they're still actively breaking out.
Hmm.
So I tell them like we have to get your acne under control before we can start working on the acne scars and the pigmentation. Absolutely. So that's when I start them on, medications. And once they're clear, they're not actively breaking out, then we start working on the pigmentation and the little, acne scars. And a lot of times what we use for instance, if I'm treating acne scars or acne pigmentation, I'm still going to use, the tretinoin, the prescription strength or retin-A, and I'm going to have them continue because they say this is going to keep your acne under control, but it stimulates collagen production, so it's going to help with the acne scars. And then I add like hydroquinone prescription strength to help with the, discoloration. And for people that don't want to do hydroquinone, there's a lot of chemical options for brightening the skin.
What the hell is micro needling, ablation,
Uh-huh.
radio frequency? What is that?
Microneedling laser. So
Yeah.
microneedling, it can either just be regular microneedling, which is just a pen, or it can be microneedling laser with RF, which is radio frequency. So there's a lot of, again, controversy around microneedling laser. First, it came out and it was like the best thing that was ever created. Everybody was doing it. They started marketing it to med spas. Then, people that were unfortunately not really trained in doing these, laser procedures. They don't have good knowledge of skin, different types of skin, thicknesses, everything. They started doing it. So now they're noticing complications. So one of the drama around microneedling laser is the fact that it can cause fat loss in the face. So now there are all these people saying, "Oh, I did microneedling is the worst thing that I ever did. It actually ended up hurting my skin because now I've lost fat in my skin." So, and my reply is always like, "Well, who did you go to? Because you really, in order to do these laser procedures safely, someone needs to have a very good, solid knowledge of skin, your skin, the thickness, what we're treating." So, yes, microneedling laser with RF, if you go very deep, it can potentially melt fat. But for the areas that we're treating, we're mainly trying to get into the dermal layer, which is about 1 to 4 millimeter thickness. Again, some people have thicker skin, some people have thinner skin, and you need to be able to tell that. There are areas of the skin which has thinner, skin, like, the area underneath your eye, your eyelids. So you need to adjust that level. You need to adjust the energy level. If you do the same setting, for everybody, you're going to cause some complications. You're going to cause some, unwanted side effects. You got to have a good knowledge of skin and know what it is that you're treating, know exactly the depth that you're in.
And that's where you see a lot of the ethical issues out there with these med spas, right? Is you see a lot of
Absolutely.
individuals who are just out there saying they're cosmetic, whatever,
Yes.
and they don't quite have that knowledge of skin.
Absolutely. People, I mean, people's skin is very different. Not everyone has same type of skin. Even for myself, for instance, I have thinner skin compared to other people. So if I'm ever doing the microneedling laser on myself, the depth that I would use on myself is much more superficial compared to someone who has thicker skin than I do. Like men, they have thicker skin compared to women. If you're older, you tend to have thinner skin compared to like a younger person that have more collagen. So you have to be very careful and knowledgeable about who you're treating and what settings you're using.
So the microneedling is actually doing what?
So microneedling is like little, pretty much needles that you cannot see, and it just causes like little micro injuries to the skin.
Got it.
And then pretty much it
Stimulates.
simulates your own body's natural response to heal itself. And that way it's increasing collagen production, elastin production. That's how it can, cause the skin tightening and the firmness. And it helps beautifully with skin texture, tone. It's great for acne scars. But one thing I have to say about microneedling laser, it does not lift your skin. So I know a lot of these like marketing tactics it can be very misleading in these med spas. They post pictures and say, "Oh yes, look at this. It like lifts your skin. It gives you that snatched look." It does not lift. For people that have mild to moderate skin laxity, because you do get that collagen elastin production, you get that firmness. Yes, you are going to notice some lifting. For people that have a lot more skin laxity, you are not gonna lift that skin. No, that's surgery. And I'm very honest with my patients. I think it's very important to be honest with them, to have realistic expectations and results, because last thing you want is for patients to be unhappy and say, "Well, I thought it was going to do this."
So for those non-dermatology trained
Mhm.
providers,
Yes.
what is a common mistake that they may make?
I mean, they can cause a lot of problems. They can, with Botox, it can draw people's eyebrows. With fillers, they can, give people like asymmetrical look, use the wrong filler in the wrong area, cause a lumpiness, make people look weird, overfill with laser procedures. I've seen burns. I've seen, again, unwanted fat loss. I've seen discoloration, scars. So I've seen it all. I think, unfortunately, because of social media, there's so much misinformation and false marketing going on. Anyone can call themselves anything. And unfortunately, most people are not educated as far as the terminology of who's actually what.
Right. How is the dermatology field protect against this? Like how what are they doing? Are they taking any steps in the direction that you see that's going to help be able to separate this publicly so that the public understands the difference?
That's where the problem is. There's no regulation. They don't. That's where medical board does not regulate all these non-certified, specialized people that are doing these procedures. So pretty much anyone can be doing injectables, fillers, laser procedures.
What would you like to see happen?
I would like for the board to be more active. I would like for them to oversee all these med spas and make sure that people that are doing these procedures are actually certified, that they know what they're doing and they train properly. I would like to see dermatologists and plastic surgeons doing the actual cosmetic and aesthetic treatments and not other specialties. Because, I mean, we went to school for this. This was part of my training. I didn't take a weekend course. Not only that, it was part of my 3-year training, but you can even do extra year fellowship. All the conferences that we go to, we constantly learn about this. This is not something that I just watched on YouTube the night before and I'm doing on my patients. This is not something that I'm claiming that I know how to do. I know how to do this.
Yeah, I think patients don't quite get that the skin is a vital organ. You
Yes.
can't live without your skin.
Hmm.
And so for me, there aren't people out there taking a pulmonology course over 2 days and then saying that they can, fix your lung or
Hmm.
do or treat your lung. Now, again, to a certain extent, there are individuals that, aren't necessarily trained in pulmonology or
Hmm.
trained in critical care that can help pulmonary and critical care physicians and can
Hmm.
operate in that space because they've been exposed. But this is different. I mean, this is what you're talking about is individuals who take a course over 48 hours and then all of a sudden they didn't know what they were doing on Friday and now they're
Hmm.
injecting on Monday, right?
Exactly.
And so that I can see how that would be a major issue. And it does need to be regulated. How do you do it?
I know.
I don't know.
Part of the problem is social media also. I feel like if you have a lot of followers, somehow that gives you this false credibility that you're an expert. You know what you're doing. You know what you're talking about. I see these again, non-dermatologists who give skincare advice and they tell however many thousands of followers that they have about what they should use on their skin, what they shouldn't, or what works and what doesn't. And I'm like, you're not trained in this. Like, why are you giving out false information? To be honest with you, that's the reason why I started my social media page because I realized that I cannot argue with someone on their social media page. The only thing that I can do is have my own social media and try to educate people as best as I can and give people the right information. I cannot control who people listen to,
Hmm.
but I can provide the information and just hope that patients or people would listen to the right physician when it comes to their skin.
And that I love because I think there's this term out there that I can't stand. It's called combat misinformation. I
Hmm.
don't want to combat misinformation. I want to give factual, appropriate information,
Absolutely.
period. Right. And I'll put it out there. Part of the reason why we started this show, put this information out there so individuals can understand
Yes.
what this really is.
Yes.
Right. And then you differentiate yourself. Unfortunately, for a lot of influencers,
Hmm.
if something is produced well,
Hmm.
people believe it. All
Absolutely.
it takes is really a high elevation in production, and
Yes.
people are like, "Oh man, it must be true." Right?
Exactly.
Story like that's got to be true, right? I mean,
Exactly. Exactly.
and that's the issue that you run into.
Yes.
So I get it. Now you've spent a few moments today
Hmm.
talking about diet, hydration,
Hmm.
sleep
Hmm.
for
Hmm.
skin.
Yes.
Is there anything else you want to say to add to that?
Well, I feel like skin health starts from inside. So all of that matters. And again, getting on the right skincare routine and being consistent and doing the little, procedures in here and there to age gracefully. Aging gracefully doesn't mean that you should let yourself go. All the wrinkles that you're getting is fine as part of aging. You should take care of yourself. Skin is the biggest organ and skin health matters.
Yeah, I remember my esthetician when I first started going. One of the first things she ever said to me, her name was Jeanette. And I'm 14 years old, and she said, Jamie, your skin represents what's going on inside your body.
Hmm.
The first thing you need to do when you wake up is drink an enormous glass of water and
Hmm.
just wash out your body and keep it clear, is what she would say to me like every time, right? And I swear to this day, I'm 44 now. It's, what is that, 30 years ago? Jesus. Like to this day, that's why I drink a big glass of water when I get up in the
Oh,
morning,
good.
is because she
See?
said that,
Exactly.
right? And I think that she's right. Is there a difference between skincare for adolescents versus adults?
Absolutely. When you're an adolescent, honestly, all you need is a good cleanser. I prefer gentle cleanser unless you're having some, acne issues, and you can use something with salicylic acid, glycolic acid.
What's your favorite brand? Throw it out.
Over the counter, CeraVe and Neutrogena, they do have very good acne washes. I'm not a big fan of benzoyl peroxide, so that's not something that I should recommend for my patients. So you can do that. And then again, depending on if you're having acne, you can do like a very low strength tretinoin prescription strength and a moisturizer at nighttime, sunscreen during the day. That's all you need. Then when you get into your 20s, you can introduce vitamin C serum to your regimen. That's an antioxidant, is great one. Good cleanser, moisturizer at nighttime, sunscreen, vitamin C serum. Then when you get into your 30s, late 30s, early 40s, that's when you do want to, get on an actual skincare routine because each decade our body's collagen production, the rate starts to go down. So
Yeah.
you need to kind of wake up your body, and each decade kind of gives it a little oomph to start producing collagen.
Do you have like a very positive patient story? We have, at the end of every episode, we have Positive Pulse, where
Mhm.
we talk about, essentially what a patient that you've taken care of has gone through and has
Mhm.
been really positive. They had a very positive outcome. You had a positive effect on their life. Is there a story you want to tell us?
There was a patient that I used to see for a full skin exam, and he was having some hair loss issues. So I did my regular workup for hair loss. I said, you're having this hair loss issue. We've been talking about it. Let's just do some blood work. So I ordered what I normally order, and I checked thyroid. That's one of them. And he was diagnosed with thyroid cancer.
Oh, wow.
So next time I saw him, he actually came in and he had like a little gift card for me. And he was like, thanks to you, now I'm here on the live because you helped me to go, get checked. And I was diagnosed with thyroid cancer, and I'm still here. And now that, he's done with his treatment, the hair is coming back. He's very healthy. I still see him for a skin exam. But that trust, and every time when he comes in, he's so thankful. It just makes me good about what I do.
That's a wonderful story. And again, it just goes to show you that dermatology really does go beyond the skin.
It really does. We're not just pimple poppers. We're not just people that do Botox and fillers. We actually really do help people.
Anything else you want to say to everybody?
Wear your sunscreen, see your dermatologist, do your research, make sure you're seeing the right doctor, and don't just trust anything that you read on social media.
And where can we find you?
I'm in Newport Beach and Huntington Beach. So, Pater Plastic Surgery and Dermatology in Newport Beach, and the practice in Huntington Beach is Orange County Dermatology and Surgery.
Nice. And on Instagram,
Derm Queen.
Derma Queen.
There's a funny story behind this. During COVID, my husband used to be at UCI. So he was a plastic surgeon at UCI for years. He finally decided that he's going to leave and he's going to start his private practice. He gives his resignation letter February 2020.
Ooh.
March, everything shuts down.
Yeah.
So then there was this plastic surgery practice in Newport Beach. There were two plastic surgeons. They were like, what, why don't you come join us? We have a med spa. Your wife can take over that, turn into dermatology practice / med spa, and you can buy this practice. So we were there for a little while, and there was this beautiful front office lady, and later became the manager, that she used to call me the queen. I'm like, you're the queen. You're beautiful. You're the queen. And then she's like, you're the derm queen. So then that title just stuck. And then later my car, we just put the plate as Derm Queen as like a joke. And then later I was like, when I started my social media page, I was like, we're just gonna go with Derm Queen.
Branding.
I know.
I love it.
The Derm. We started, I was like, well, I can
You
change
need
it.
trucker hats and a t-shirt.
I know, Derm Queen.
Derm
I
Queen. You heard it all from the Derm Queen. Thanks again for watching and listening. We're on Instagram with the Health Exchange Podcast. Get us everywhere you get your podcasts. We're on YouTube, iHeart, Spotify, Apple, all the things. We'll see you every Thursday at 9 a.m. Pacific, 6 a.m. Eastern. See you this Thursday.